Hi, my name is Yang, and this is my research view. The article that I choose is the incorporation of Pilates-based core strengthening exercise into the rehabilitation protocol for adolescents with patellar femoral pain syndrome, a randomized clinical trial. And here's my full concepts and core strengthening exercise, adolescents, patellofemoral pain syndrome, a randomized clinical trial. And then this is my cinemas. And there's my search strategy, copy that pasting, get the my article in the third one. Back to the paper. Okay. This is a randomized controlled clinical trial, and the study randomly access the adolescents with a patellofemoral pain syndrome with the two groups. The control group is the receiving traditional physical therapy, another one is the experimental group, also the study group, which is the Pilates exercise plus the conventional program. And the patellofemoral pain syndrome is a prevent muscle skeleton issue, particular in active adolescents, and then can significantly impair mobility and the quality of their daily life. And this paper addresses PFPS, aiming to find an effective non-invasive treatment for young teenagers suffering from this syndrome. And the main research question is to evaluate how the Pilates-based core strengthening exercise program affected pain, lower limb muscle strength, functional status, and health-related quality of life in adolescents with patellofemoral pain syndrome. For methodology, there have 34 adolescents, which is the ages from 14 to 17, diagnosed with PFPS crucial recruited from physical therapy and orthopedic clinics, and measure by using the visual analysis scale. And the analysis techniques are the ANCOA. The ANCOA was used to compare pre and post-treatment outcomes, and with the pre-treatment score included as a convertities. And the finding is to reduce in pain and improve the muscle strength, enhance the functional status, improve the quality of their daily life. This study found out the group of the Pilates exercise can improve the muscle strength in the hip abductor, external rotator, and the knee extensor, and in the improve their quality of life, daily life, uh, can increase the physical therapy, psychosocial health, and overall quality of life. So in the practical applications, the study has a significant real-world implication for the rehabilitation participants for young teenagers with PFPS, and it suggested to adding Pilates exercise to traditional physical therapy and can lead to improvements in pain, muscle strength, and quality of their daily life, which it could be useful for clinicing seek effective treatment for PFPIs. So limitations of this paper, I listed four, and there are simple size, limited participant, potential base bias, long-term date. So the simple size is quite small. It's a little bit small. There are only 34, and that might be generalizability of the results. A large sample size would strengthen the conclusions. And the limited participants diversity is to find out that only in the age from 14 to 17, so the finding might not be applicable for other ages groups, like older groups, because for this age groups, their recovery is slower than the young teenagers. And for the potential bias, the participants in the study were recruited from the specific clinics or the hospital, which could lead to a selection bias. And also, although the outcomes assessor was blinded, the study links to more daily detailed description of a potential bias related to the randomizer or measurement process. And the long-term date, they don't have long-term date. They just only have 12 weeks, which is a limited understanding of long-term effect of the Pilates exercise on PF pies. Also, the long-term data following up was included to assess whether the improvements were sustained after the intervention period ended. So overall, this study provides the valuable evidence supporting the use of Pilates-based exercise in rehabilitation for young teenagers with PFPS. And this is my references. Thank you.